take a listen to this sound, familiar to a lot of people. So, are you imagining a guy? We are talking about women. Women snoring, and it is more than an annoyance because a lot of women don't realize that they too are at risk for a serious condition called sleep apnea. A condition where you stop breathing in your sleep, sometimes hundreds of times a night, with real health consequences. In fact, a new poll reveals as many as 5 out of every 100 women have sleep apnea. And Dr. Mayer Krieger is heading up the poll and joins us from Washington this morning. Dr. Krieger, thanks so much. I know we think we know what sleep apnea is, and we think we know its health consequences, but take us through them one more time.
Well, sleep apnea is a condition in which people stop breathing during sleep repetitively through the night. And they'll stop breathing about every minute, so they stop breathing hundreds of times a night.
And the consequences for your health include?
Oh, there are many. Excessive daytime sleepiness. People can't stay awake. They fall asleep when they don't want to. They have trouble driving automobiles, and there's an increased risk of high blood pressure.
High blood pressure, and eventually it can have heart consequences as well?
Severe heart consequences, including heart failure, heart attack. So it's a pretty serious condition.
Let's talk about women and snoring, because again, women, of course, don't really snore. They just occasionally, how can we say this discreetly? I've read a statistic, tell me if it's true, 30% of all women just snore.
Well, that's absolutely correct. As a matter of fact, the Sleep Foundation Sleep in America poll, that's exactly what they found, is that about 30% of women snore, and the stereotype used to be that women never snore. Can you ever think about any cartoon you've ever seen where a woman snores? It just doesn't happen.
Now, if you snore, you are at risk for having apnea, or it could be a sign you have apnea, right? If you don't snore, you probably don't have apnea.
Well, yeah, that's true most of the time, and the difference between what happens in someone who simply snores and someone who has apnea is that when you snore, the noise is continuous. It's always there. And what happens in apnea is they become quiet. And it's the quietness that's very distressing and very disturbing, and that's when they stop breathing. Now,
you say a #1 way to try to control apnea is lose weight. That just a few pounds can make a difference.
Yep. And you don't have to lose a lot of weight. In other words, sometimes if you weigh 250 or 300, sometimes only losing about 20 or 30 pounds will take care of the whole problem. And what we found in our poll just now is that the percentage of women that have sleep apnea goes up like crazy if they are overweight. And right now, roughly 60% of American women are either overweight or obese.
And there is a new generation of machines out, and can you run us quickly through them? Because they may look like they're impossible to sleep with. In fact, they are life-saving to sleep with. So quickly tell us about them.
Well, I'm going to show you some of a complete circuit right here, Diane, and this is a gadget, and this is a flow generator. This generates pressure, and it's connected to a hose right here, and this hose in turn is connected to these prongs that go right into the person's nose.
But it looks awful to sleep with, you know, for people. They think, I can't sleep in that.
As a matter of fact, it looks awful, but I can tell you that about a week or so in our clinic, there was a woman that described this as a love machine. She said, I now love to sleep with my husband because I don't worry about him breathing all night. So these machines, they used to be about this big, and so they're small and so forth. Now this shows you...
I'm going to just move you down. I know that these are different sizes of machines because I want to move you down. We only have a couple of seconds left to tell me about these masks at the end of your table there. Because some of them cover the entire nose and mouth. What's the difference?
Yeah. Now, this is a mask that just covers the nose, and I'm going to bring it up towards my nose so you can see. And it just fits right over the nose. And some of them are longer, and they will also go over the mouth. And here are 2 other types of masks that basically go right into the nostrils as well. These are prongs. And so these are manufactured by 2 separate companies.
All right. Well, again, it's good to know that these are smaller and lighter pieces of equipment now, different kinds of masks depending on the kind of apnea you have. And most of all, I know that you want to say to everybody, Dr. Krieger, this is no joke. You can't fool around with
No.
sleep apnea. And
No,
we thank
you
you.
can't fool around with it.
We thank you so much for joining us this morning from Washington.